DVT or deep venous thrombosis is today's topic, and it's the third most common cardiovascular disease after heart attack and stroke. The definition of deep venous thrombosis is clot forming in one of the deep veins of the body. It usually starts in the lower extremity, the calf and the thigh, and if you are unlucky or the treatment starts too late, it can go on to the lungs and can be a deadly disease. Other sites could be the upper body as the arms, or in the brain, in the venous thrombosis there, but this is more rare, and often you have an underlying disease that you have to look for. When you come to the risk factors for deep venous thrombosis, it's not completely the same as in arterial thrombosis, as heart attack and stroke. You have some of the same as age, overweight, and smoking, but other are immobility, inherited genetic factors, and you also have some surgical intervention, trauma, but it's important to remember the family history as in other embolism diseases. Symptoms of a DVT in the leg, as we talk about today, is a swollen, warm and tender. Often you have problems standing or walking on the foot. It's usually one leg, and if you have a swollen leg at both sides, it's often another cause. The muscular in the affected area or the affected foot is hard. It feels almost like stone. And some of the superficial veins can become more prominent. The diameter of the leg, if you have a measuring tape or something like that, is usually bigger, so it could be a good idea as a doctor to have a measuring tape available so you can measure, because it can be difficult to see it with your bare eye. When you come to the diagnostics, you start with an anamnesis, and then you can get a suspicion. You have to rule out some different diagnoses like infections, but when you have a clear suspicion, you can take a D-dimer. If the D-dimer is normal, below 0.5, it's not an acute DVT. It can be an older one, but it's not an acute DVT. If the D-dimer is raised, then you have to take an ultrasound, and this is important, and it's something you can do by yourself if you have the right training. Otherwise, you need to refer to the hospital to get it done. Other measuring methods you could use, or diagnostics you could use, is CT or MR, but that's not the golden choice. So this is an algorithm of the diagnostics. You start with the D-dimer if you have the suspicion. You can rule it in or rule it out. If the D-dimer is just above the normal level, you have to go through the different diagnoses to see if this is the most common thing. And then you take the ultrasound, and then you get a yes or no. If the clinician are suspicious but you don't find the DVT in the first ultrasound, sometimes we do a second ultrasound in a week, just to check if it's early and starting getting there. So it could be good to have an extra ultrasound if you are certain of the diagnosis, but you don't get it on the first ultrasound. So why should you as a doctor, practitioner, do this ultrasound? It's easy. It's a good way to start treatment early, because you don't want to start risk treatment like getting bleeds if it's not necessary. And it's always nice for the patient to get a diagnosis before they leave, and you don't have to refer them to others. So ultrasound is something everybody can learn. You just need the right proper education and the right machines, and then you can start, and with experience it becomes easier and easier.